Welcome to the deep dive. Today, we're getting into a pretty serious topic in vet med, adenocarcinoma of the pancreas in dogs and cats.
Yeah, it's definitely a tough one.
We've got a solid medical overview here as our source text, and our mission really is just to pull out the key stuff about this condition, make it clear, make it understandable for you listening, kind of get the essential picture.
Exactly. And look, while hopefully it's something your own pet never encounters, understanding it,
Well,
it does shed light on how some of these really aggressive cancers work in our pets.
right, it gives you that broader perspective on the challenges, diagnosis, treatment, that kind of thing.
For sure. Across different species even.
Okay, so let's dive in. Adenocarcinoma of the pancreas. The basics first, what exactly is it?
Okay, so essentially it's a malignant tumor. Cancer, basically. And it starts in what's called the exocrine pancreas.
The exocrine part. That's the bit doing the digestive enzyme work.
That's the one. It's like the factory part of the pancreas, making the juices that break down food. So these tumors, they can pop up in little tubes, the ducts that carry the enzymes, or in the actual clusters of cells making them, the acini.
And the source was pretty clear this isn't usually a slow burn kind of cancer, right? It mentioned it's aggressive.
Yeah, that's a really critical point. Unfortunately, by the time it's usually picked up, it's often already spread, metastasized.
Metastasized, meaning
Yeah.
it's moved beyond the pancreas itself.
Exactly. It commonly goes to the lymph nodes nearby, the ones draining that area.
Yeah.
Also to other organs. Inside the abdomen, the liver gets a specific mention, but could be spleen, kidneys, you name it.
Wow.
And even just sort of seeding throughout the lining of the abdomen, the peritoneal cavity.
Okay. So who gets this? Is it common? Rare? Certain pets more at risk?
Overall, it's pretty rare, thankfully. In dogs, the numbers are like maybe 0.5% up to just under 2% of all tumors they find.
So not many.
Not many at all. It's slightly more common in cats, maybe closer to 3% of all the tumors, so still quite rare, but a bit more frequent than in dogs.
Does the source give any clues about which dogs or cats, like age or breed?
Yeah, it does point to a few things, particularly in dogs. Older age is definitely a factor.
Okay.
Female dogs also seem to have a higher risk, and interestingly, one specific breed is mentioned, the Airedale Terrier. They seem to be more predisposed.
Huh. An Airedale link. What about the actual age when it typically shows up?
For dogs, the median age mentioned is about 9 years, average is 9.2. So senior dogs, really.
And cats?
Cats tend to be a bit older still. The median and mean age listed is around 11.6 years.
Yeah.
So yeah, it definitely seems to be more of a disease of older pets.
All right, so primarily older dogs and cats, a bit rarer overall. Now, what about signs? What might an owner actually notice at home? Because catching anything early seems better, even if it's aggressive.
Well, that's the really tricky part here. The early signs are often super vague, non-specific.
Meaning they could be caused by lots of different things.
Exactly. We're talking things like maybe a fever that won't go away, vomiting, just general weakness or lethargy, not wanting to eat. Anorexia, we call
Right.
it. Sometimes jaundice, that's when they look yellow, the gums, skin, whites of the eyes, maybe signs they're not absorbing nutrients properly, and just, unexplained weight loss.
Yeah, that list sounds like it could fit a dozen different problems, not just cancer.
Precisely. That's the challenge. Abdominal pain can also be there, but the source says it's pretty variable. Some might be obviously uncomfortable, others maybe not so much.
Is there anything a bit more specific to look out for?
Well, one thing highlighted as potentially more concerning is fluid building up in the belly abdominal effusion. If you see that in this sort of context, it can often mean malignant cells are floating around in there.
Okay, that sounds serious.
It is. And another thing, the cancer can spread to bone and other soft tissues, and sometimes that can actually lead to a bone breaking just because the cancer weakened it, a pathologic fracture.
Ooh, that's rough. Any differences noted between dogs and cats and how it presents?
The source does mention that in cats, sometimes a vet might actually be able to feel a mass in the abdomen during an exam. That could be a big clue.
A palpable mass.
Right. And we should also mention something called perineoplastic syndromes. These are like side effects the cancer causes elsewhere in the body, not directly from the tumor mass itself.
Like what?
Could be things like a nasty skin condition called epidermal necrosis, or hormonal issues like too much insulin, hyperinsulinemia, or too much glucagon, hyperglucagonemia.
Wow. Complex.
Yeah. And interestingly, for cats, they mentioned the average time from when owners first notice signs to getting a diagnosis is about 41 days. but the range is huge, from just a couple of days up to 6 months.
41 days average. That doesn't sound like a lot of time.
It really isn't, especially when you consider how vague those first signs might be. It underscores how quickly things can sometimes move once it becomes obvious something's wrong.
Okay, so with all these varied signs, some subtle, some maybe overlapping with other issues, it sounds like diagnosis must be a real puzzle. And you mentioned risk factors, but the source says the actual causes are still unknown.
That's correct. We have those associations: older age, female dogs, Airedales, but why it develops. According to this text, we know. We just don't know the root causes or definitive risk factors yet.
Which I guess leads right into the diagnostic challenge. If it can look like so many other things, how do vets even begin to narrow it down?
You nailed it.
Yeah.
It's tough. The list of rule-outs or differential diagnoses is pretty long. Pancreatitis, just inflammation of the pancreas, is a huge one.
And can't they happen at the same time?
They absolutely can. You can have pancreatitis and a tumor concurrently, which just muddies the waters even more.
Okay, what else is on that list?
Things like pancreatic pseudocysts. Those are like fluid pockets. Benign little lumps called pancreatic nodular hyperplasia, which are common in older animals anyway. Liver tumors.
Right.
Other causes of vomiting or jaundice. A condition where cancer spreads all through the abdominal lining. Peritoneal carcinomatosis. And specifically in cats, other reasons why fluid might build up in the abdomen. It's a lot to sift through.
So what about just basic blood work? Does that help point the way?
Usually, not specifically. Routine blood tests often just show pretty non-specific changes. Maybe mild anemia, perhaps a high white blood cell count suggesting inflammation.
Nothing screaming pancreatic cancer.
Not usually, no. Now, looking at pancreatic enzymes like amylase and lipase, high amylase on its own isn't considered very reliable for this.
Yeah.
But a really high lipase level, especially in dogs, that might be a non-invasive clue, something that raises suspicion for a tumor.
Okay, so lipase might be a bit more useful sometimes.
Potentially. And then there are those rare metabolic changes we mentioned affecting glucagon, insulin, maybe amino acids, but those aren't routine tests.
What about looking inside? Imaging, like x-rays or ultrasound?
Yeah, imaging is absolutely key. Abdominal x-rays or radiographs, they might show a visible mass or maybe just a general loss of detail, like things look kind of hazy. That could be from pancreatitis or fluid.
So suggestive maybe, but not definitive?
Right. Ultrasound is usually more helpful for looking at the pancreas itself. It might reveal a single mass or even multiple masses.
Okay.
It could also show signs suggesting pancreatitis is also going on, like the pancreas looks bigger, or the texture seems mixed up, or the fat around it looks brighter, more reactive. Ultrasound can also pick up pancreatic thickening, that abdominal fluid, or various little nodules.
Sounds like ultrasound gives a lot more detail.
It does, but, and this is a really important, but from the source, it can be super difficult, even with ultrasound, to tell the difference between a cancerous mass and those benign nodular hyperplasia changes we mentioned earlier.
Ah, so even ultrasound isn't always clear-cut.
Exactly. And sometimes, though it's rare, the pancreas might even look pretty much normal on the ultrasound scan. And the only subtle clue might be that the main pancreatic duct looks a bit dilated or widened.
Wow, okay. That sounds incredibly challenging to diagnose for sure then. So how do you get a definite answer? What's the gold standard?
The most definitive way is a surgical biopsy. Actually taking a small piece of the suspicious tissue from the pancreas during surgery and sending it to a pathologist to examine under the microscope.
Surgery, okay. Is there anything less invasive?
Yes, a fine needle aspirate, or FNA, that's where you use a very thin needle, usually guided by ultrasound, to suck out some cells from the suspicious area.
And that can tell you for sure?
It can be very supportive.
Hmm.
Sometimes the cells look clearly cancerous, and especially if surgery isn't really a good option, say because the disease looks widespread already, an FNA result might be enough evidence to confirm the suspicion and guide palliative treatment decisions. But biopsy is still the absolute confirmation.
Okay, got it. So diagnosis is tough, often needs invasive steps. Let's shift to treatment. Once it is confirmed, what can actually be done for these vets?
Well, this is where the news is.
Okay.
Pretty sobering, unfortunately. The medical text we're working from states quite clearly that there's currently no reported curative treatment for pancreatic adenocarcinoma in dogs and cats.
No cure.
No known cure. So the main focus really shifts to palliative care. That means managing symptoms, relieving pain, and trying to give the pet the best possible quality of life for as long as possible.
And pain management must be huge.
Absolutely critical. The source emphasizes aggressive pain management, likely using multiple types of pain relief medications together.
You mentioned surgery for diagnosis. Does it play any role in treatment itself?
It can, potentially. Surgery might be considered in some specific cases, mainly to alleviate a blockage if the tumor is physically obstructing the intestines or the bile duct.
Okay, so relieving secondary problems.
Right. But the text points out that often, by the time of diagnosis, the cancer is too advanced for surgery to be a truly viable option for tackling the tumor itself.
Because it's already spread.
Exactly. Or it's just too involved with vital structures. If surgery is feasible, though, removing part of the pancreas, or sometimes even the whole thing, a partial or total pancreatectomy.
Whoa, you can remove the whole pancreas.
It's a major surgery with significant consequences, like causing instant diabetes. But yes, it can be done. In some cases, if you can get the tumor out, it might help prolong survival time.
Okay, and what about that pancreatitis that might be happening alongside it?
Yes, treating any concurrent pancreatitis is also really important for managing symptoms and making the pet feel better. And then there's just general supportive care, things like anti-nausea meds, fluids to combat dehydration, making sure they get enough nutrition, maybe through appetite stimulants or even feeding tubes if necessary.
Right, supporting the whole patient. What about drugs aimed at the cancer itself? Chemotherapy? The source mentioned gemcitabine.
It did. Gemcitabine is a chemo drug used for human pancreatic cancer. And yes, it has been used in dogs for various cancers. However, and this is important, the source specifically states it is not considered the established standard of care for canine pancreatic adenocarcinoma.
So it's used sometimes, but it's not a go-to protocol.
Pretty much. And because this cancer is so rare in pets and cancer treatments are always evolving, the text strongly advises consulting with a veterinary oncologist. They'll have the most current information on potential therapies, clinical trials, or specific approaches that might be suitable for an individual case.
That makes sense. Always best to talk to the specialist. So even with these potential treatments, the overall picture sounds difficult. What complications can pop up and what's the general outlook?
Yeah, the outlook is generally tough. Complications listed include those blockages we talk about, intestinal or biliary. Also, pancreatic abscesses can form, or peritonitis, which is that inflammation of the abdominal lining, and of course metastasis, the spread of cancer.
And the prognosis overall?
Generally speaking, it's considered poor. The source indicates that progression to death is often quite rapid because we lack that curative treatment option.
That's hard to hear.
It is, but there's a small glimmer mentioned. In individual cases, and they stress this is not typical, where a tumor can be completely removed surgically and the patient receives chemotherapy, and there's no sign of metastasis elsewhere. Well, those patients may potentially have longer survival times.
So a very specific set of circumstances might lead to a better outcome, but it's not the norm.
Exactly. That seems to be the takeaway.
Okay. So let's try and wrap this up. Summing up this deep dive, pancreatic adenocarcinoma in our dogs and cats. It's rare, thankfully, but it's highly aggressive.
Right, and often diagnosed late because the early signs are just so nonspecific.
Making that diagnosis a real challenge, often needing advanced imaging and biopsies.
Definitely. And then treatment. Well, it's mostly about palliative care, managing pain and symptoms, because sadly there's no cure reported.
Leading to a generally poor prognosis in most cases.
That's a fair summary of what the source tells us. It really drives home why, even though those signs are vague, paying attention to changes in older pets is important, and why vets need to consider this possibility, even if it's uncommon, and utilize those more advanced diagnostics when suspicion arises.
Yeah. This has been, well, a difficult deep dive, but an important one into a really serious condition. It definitely makes you appreciate the complexities involved in veterinary cancer care.
For sure.
And it kind of leaves me thinking, given how challenging this specific cancer is, what are the bigger lessons here? About the ongoing need for research, not just in pets, but in human cancers too, trying to understand why these aggressive forms happen and how we can possibly get better at tackling them.
That's a really good point. It's a shared challenge, understanding the biology of these diseases.
Definitely something to keep pondering. Thanks for joining us on the Deep Dive.